Welcome to Beyond the Frontline podcast, where your hosts, U.S. Air Force veterans Donna Hoffmeyer and Jay Johnson, will help you transition from the front line to the home front. Listen every other Wednesday as they will bring great conversations, resources, tips, and feel-good stories that will resonate and relate. Now, here's your hosts, Donna Hoffmeyer and Jay Johnson.
So let me get this straight. So you did business, you tried human resources, education, aviation technology, and pre-med, so medical. And your degree is what and what?
So I was a dual major in college.
Okay.
I was a engineering and a medical. So originally I went to college. I was wanting to be a orthopedic surgeon. I saw the way medicine was going. So even though I got my pre-med degree and my engineering degree, I decided to stay with engineering. Then
wait, your dual major was engineering and pre-med together?
Mm-hmm.
Holy shit.
Yeah. So I was an honor student way back when. Then I actually was offered a GM position. So when I was in ROTC, I was supposed to be a missile launch officer in the reserves. That
would have been kind of boring compared to all the other stuff you just did.
Yeah. So I went in, and a guy I worked for part-time offered me a general manager's position in his company, mm-hmm. which was, he was a franchisee, but he had multiple locations. I took those businesses and I actually wound up turning them into 15 of the top 20 in a period of about 18 months as the GM, and then corporate saw, and so I went to go work at the corporate side in HR as a VP of marketing, development, and human resources. So I led the expansion of the company into China back in the 80s.
Oh, see, 80s. We can blame you for all of Temu and Shein, and it's your fault. You started all this. Your background is beyond extensive. You need to write a book. I mean, you seriously do. So, hey, I'm going to start this, and I'm sure people are wondering who we're talking to right now, and who's this person that has a double major in pre-med and in engineering, because I'm not sure who takes that on. One of them alone is challenging enough. But this is Beyond the Frontline, as y'all know. And I am part of a team of two, except I'm missing one. So Donna's here today. Jay's out, a little bit of a family emergency. So I said, that's all right, I'll take it on, because we know the guest that we're bringing on. He's actually a good friend of mine. And this is Mr. Mike Wyatt. Hi, Mike.
Hi, Donna. How are you today?
That's good. I just every time I talk to you, it's like a whole new, I can't even keep straight all the stuff that you've done. And so I just crack. I don't even try to keep up. It's just like a new story. And I swear to God, you and I have talked, and then you're telling me this stuff. I didn't even know you had a double major. I'm like, holy crap. But even though he's super interesting, and I swear we could bring him on just for super interesting people, we're actually bringing him on for a reason. Because Mike is a VSO, a veteran service officer, and he is a very good one. And Mike and I met randomly through a mutual friend, actually his chiropractor, is a friend of mine, and calls me up and says, hey, some gentleman and his wife came in, and they were talking about veteran stuff, and I said they should talk to you. And I was like, okay. And that's how Mike and I met. And so I've actually worked with him on a case here and there. And he comes to our veteran breakfast, and every time he comes and talks, everybody wants to keep talking to him because he holds all the knowledge about disabilities and what I want to talk about today, the PACT Act, right? Because that's the new hot thing that's out there. The VA finally came to be and said, all right, we're opening up for the PACT Act, and we want people to apply, and they have. And it has absolutely flooded the VA, and they are months and months behind. So if y'all waiting for your medical records or you're waiting for responses, you just keep waiting. It's going to be a while. Right, Mike?
That's true. On the record side for the VA, they're actually running about 9 months behind in getting people's records.
God.
So they're just now up to January 2023.
And oh my Lord. And we're in October, right? So it's going to be a while. That's going to be a while. So, see, and the joke is that he has, and I'll tell you why he's got on me about the PACT Act, because I had a reason that I needed to apply, of which I didn't know. And then he's like, hey, you need to do this. And so after a couple prompts, I finally did. And then I've sat on it because it's a big delay. And so I told him, like, see, procrastinators like me are helping people like you. I'm waiting for the wave to go by. So let's start with PACT Act, what it is. We keep throwing the acronym out, but just in case there's somebody living under a rock there, what is it?
So what the PACT Act is, it stands for the Honoring Our Promise to Address Comprehensive Toxics Act of 2022.
That's a mouthful.
Yeah. So that's the new law that basically expanded VA healthcare and benefits for veterans exposed to burn pits, Agent Orange, and any other toxic substances and exposures that you've been exposed throughout your career. So it's not just war-related, Agent Orange, radiation, asbestos, things like that. But the thing that it also did was it opened it up to spouses and dependents. So everybody's probably heard the Camp Lejeune.
Oh, the water.
Water contamination. So
right.
That came about as well because of a whole lot of lawsuits for stillbirths, the amount of Parkinson's and Alzheimer's and dementia in veterans. So with those lawsuits, the push went to the VFW, the DAV, and the American Legion to get Congress to act, and then they passed this, and it finally got signed into law in 2022. So this now is the largest comprehensive change to VA healthcare in the history of the VA.
Yes. So
the goal was to get more veterans into healthcare. They created 3 new categories to phase in so veterans can receive more hospital care, medical services, and nursing home care. What people don't realize is that their dependents also qualify. And I know we've talked a little bit about it, but to get that done, so example would be for the contaminated water sources, there is a separate legal couple legal agencies. So the DAV has one, the VFW has one, and the American Legion have one that they all work with to help the dependents file for any defects or things that happen due to contamination.
So when you say, okay, so when you're talking spouses, like spouses that were at Camp Lejeune and drinking the water, having issues, anything like that.
Correct. Children.
Go ahead. Yeah, well, children, that's the one where you caught me on is, we have a son that has ADHD and, I didn't think anything of it happened, and then you kind of bopped along and started asking me questions and you were like, hey, were you ever on a flight line? And I'm like, yep, I was 3.5 years. And my husband, most of his career, sucking lots of fumes. And you're like, yep, you need to apply now. Because what was it? There was a connection between
toxic exposures. As everybody that's been on the flight line is familiar with TCE, trichloroethylene, PCE, which is perfluorochloroethylene, and DCE, which is tetrachloroethylene. So, or MEK, methyl ethyl ketone. They're actually toxic chemicals that were used on aviation and electronics, and even the hospital used them in biomedical engineering. So under Camp Lejeune, just like most military bases, there are toxic plumes of TCE, PFOs, PFOAs. So that's as you would commonly hear, AFFF or aircraft firefighting foam. So that's the other thing that's out there as a contaminant in the soil.
Well, and just the fuel, right? Like the JP8 and the JP4.
JP4, JP7, JP8.
I mean, we suck
So
lots of that.
Correct. And, people think that does not count towards their exposure, but that is now part of the PACT Act. So those are all part of your toxic exposures. It's not just burn pits, your exposure to asbestos. Every time you go out to the range and you're firing a gun, you're exposed to lead. Mm-hmm. Right? So everybody in combat is exposed to a high volume of lead as well. So lead can lead to neurological issues. So that's why it's important to make a list of the bases you've been at, TDY station, deployed, list of ships if you're in the Navy, Marine Corps, or Air Force, because there are Air Force folks that are on ships, as well as any port calls. Every military installation worldwide is considered a toxic environment.
Well, that's comforting now, isn't that?
Right. So what you have going on right now is DOD and the EPA and Congress has mandated that they look at all water sources on every installation to look for TCE, PFOs, polyfluorocarbons, PFAs, and provide that. So one of the things I try to tell all active duty, if you're still active duty, every year you have an industrial hygiene survey that's done that also covers your hearing conservation, your mask fitting. Right?
I remember that.
Right. So you can get a copy of that from Public Health, and that is a viable source to use as a source document if you file for your future toxic.
But where do you go for public health? I mean, for our medical records, we go up to Illinois for the central, but what about that?
So you can go back to the public health department at the local base, or you can go to each respective service has an environmental command, and you can fill out a FOIA request and request those industrial hygiene surveys. So for the active duty folks that are getting ready to retire, I brief them on that, and I tell them, hey, go get a copy of your industrial hygiene survey. You keep that. So, and that lists everything that has MSDS, VOCs, SVOCs, those types of things. So, and you keep that till you die. Same thing with your medical record.
Hopefully not sooner than later. Gee,
Right.
I mean, the list I'm like thinking of this list, and I'm like, Lord, I see the years ticking off. I'm like, damn, 88, 87.
True.
86. Like, dang. The one that caught me, you said to me, the statistic you told me, and I don't remember this exact stat, but it was about people on the flight line and the increased risk of Alzheimer's and cancer.
Cancers, hearing loss. So the DoD released several studies that they've been doing that span 35 years. They released those 6 months and 9 months ago.
Yeah.
So people that work around the flight line or have been around the flight line are 70% more likely to have hearing loss and 80% more likely to have cancer. And what veterans don't know is, just like with Agent Orange, that can affect you 3 seconds after exposure or 70 years down the line.
Yeah.
So most everybody in the military has been exposed to asbestos. So if you've been on a base that has asbestos, or you've been living in quarters or barracks that were built prior to 1986.
Army bases.
Correct. Air Force bases.
Yeah.
The aircraft, anything B-52s, 135s, F-4s, 15s, F-4, all that stuff that was F-16s were actually built. Ships were all built with asbestos in it. So mesothelioma, again, that's a toxic exposure. It can affect you 1 minute after exposure. It can affect you 70 years down the line.
Well, go ahead. Finish.
So it's no different than Agent Orange, 3 seconds or 50 years later.
Yeah. I heard a squeak. I looked back, and I think my dog found a squeaky toy.
All good.
And the reason why I was joking about Army was because it brought me back. So when I was stationed in Germany, my parents came to visit, and we went to Freiburg. And we went up there because that's where my dad was stationed when he was drafted. And so we went up there, and I kid you not. So this is, 40 years later, he knew his dorm room. It was still there. So when you said asbestos in the buildings, I'm like, yeah. Because he was there it is.
Lead paint, too.
Oh, yeah.
We forget the lead paint. So, so it was good that the PACT Act actually came out because it actually did add more presumptives, for burn pits and other exposures. So one of the things I always ask when I'm talking to somebody about disabilities is what I just said. I want to see every base ship and TDY station deployed, any ships, any port calls. So I actually look all that stuff up. And I look at each one of the environmental commands. I go into the EPA. I look up every community, including bases that are closed.
Do they have like central areas that you can go into of metadata that you can go in and research this? Is that where you look? Is it open to the public? Is it?
Most of it is open to the public. So it's funny you asked that because I sent that to you on the links.
Good. I was just going to ask you, is it good on the forum? That's perfect. See, everybody, it'll be there if you want to know about your base and all the toxins on it. And you can look there.
So the other thing that's on there is a way to request your records.
Oh, good.
And that seems to be the biggest thing. The VA also does have something called Quick Submit. So you fill out a SF-180, and you can actually upload it online to the National Records Center for the VA. One of the things I ask people to do is if you've already filed claims, also request your C file. That's your compensation file. So that has everything that the evaluators such as QTC, LHI, these companies that are doing your DBQs, that's your disability questionnaires.
Right.
Every decision process is in that compensation file.
Oh.
So it's a good thing to have that compensation file as well as any military and civilian medical records.
That is good information.
So, and that is very, very important, especially if you have a lot of denials and referrals or deferrals, because what happens is those aren't done on a 526, which is the normal application form. Mm-hmm. They're actually done on a 996 because we're adding additional information. So there used to be you could all do it on a 521, 526, but now you can't. But the VA is, as everybody knows, is complicated. It's the biggest battle we as a veteran face is fighting the VA system.
I agree. That's the thing that kind of drives me a little bonkers is, when I applied and I submitted, I remember that everybody and their brother theirs was getting done. I mean, I had people that were retiring after me, applying after me, and they're like, oh, like 2 months, it's done. And I'm sitting here, mine was like 9 months, a year, somewhere around there. It was like forever. And I know enough of the system to be dangerous because I worked in it a little bit. And I knew my case was not a complex case. I didn't have very complicated things going on. And so I was really lost in that. And it's frustrating. And I was a lucky one in the sense that I didn't need that money at that time. It wasn't like I need to have this to kind of keep going. But there are people that is helping them financially to sustain themselves. So when they're taking 8 months and 9 months and 12 months and, it's and very frustrating. Yeah. Years and years. And, and then I see people it's a little off topic, but I find it interesting. There's the VSOs, right? And so VSOs are free to the service members, the veterans, right? And you already said you can go to the DAV and find them. The VFWs have them. PAV, do they do it? The paralyzed, do they have VSOs?
Paralyzed Veterans of America,
yep.
PVA.
Yep, they have it.
Purple Heart.
And then your counties have it. So there's county VSOs. And Mike, tell me a little difference. Because I did not know this until actually not long after I met you. There's county VSOs versus, are you like federal? I don't know what the difference, but VSO and county VSO.
So the state departments of Veterans Affairs and the county VSOs, they are paid.
Yep.
And they are considered accredited. So they can actually, you can actually do a power of attorney and they will get your records for you. Versus those of us that are in the VFW, American Legion, DAV, Order of the Purple Heart, the other veteran service, we are not accredited, so we cannot have you sign a power of attorney so we can get your medical records and do it for you. We depend on you to provide the records so we can actually do it. That's one of the battles I'm fighting right now nationally. I'm a lifetime member of American Legion, DAV, and VFW. So, and I've actually been doing stuff like this, a VSO position for about 15 years. So a little bit of experience.
Just a little.
Yeah. So with the accreditation process, it allows us to contact your doctor and get your records instead of you having to go and then us waiting. So the average wait time, like right now, as I said, is about 9 months for somebody to get their records. And so I have like 80 people in a backlog, and I pick up 5 to 10 a day.
Jeez. Yeah, you were telling me you're like referring to others that you trust. And I will say, that it is important that you have a good communication with them. My husband had a great VSO. He went to the DAV, and so the VSOs there were phenomenal with him. I had a horrible VSO when I was coming out of the military. And I was warned, too, that the person said, or somebody that knew this person said, it's either going to be amazing or horrible. He cherry picks what he wants to do. Well, he didn't cherry pick me. Got the short end of that stick. And so it was a struggle. It was during COVID. That didn't help anything. So in his defense, he's trying to paddle uphill with all this chaos. So that connection is important for that clear communication. And there's another piece, and I'm kind of leading you down a road. And I know it's a little bit off of PACT Act, but I think it's important for people to understand that finding a VSO, a solid one, and the different types of VSOs, county VSO, why is that different than, another VSO that's not paid by the state, right? And so you're kind of clearing some of that up. There's also people that will go to, I don't really know what their term is. They're paid VSOs. They're not county VSOs, but you pay them. And then there's also people that go to attorneys to have
Correct.
This done. So would you kind of pick apart what happens when you pay for a VSO and you pay for attorney? Do you have any knowledge of those or what you've seen in your experience or whatnot?
So one of the first things I say is for anybody that's on active duty and they're getting ready to separate, do BDD, which is benefits delivery on discharge, before you get out, so that your disability is done when you get out.
And that's 6 months out, right? They can start.
It's 3 to 6 months out. That you need to do that.
Right.
2 years out, you need to start to ensure that you have all your medical issues documented.
Yes, and I'll tell you why that's extremely important, because this happened to me, is that I had been in the military 12 years. I got out, and then I came back in. And anything that's not continuous in the military or any abnormal deviation, it can mess things up. And so I went to the records department, and I said, hey, I need a copy of my records on a CD. And they're like, yes, ma'am. And so they hand me it, and it went back like 2 years. And I was like, I'm retiring. I have a couple more years than this. And they couldn't find my record. And they're looking and looking and looking. And they're like, oh, you have to go up to the central, which is Illinois, right? And I was like, okay. And then before I ended up doing that, I don't know, we had a discussion. And they said, let me look one more place. They said, let me look down at Lackland. Apparently, my record was in the basement in Lackland somewhere. My entire career was sitting hard copied, not uploaded, in a basement in Lackland, and I was very lucky there was no flood or some randomness that happened.
That actually happens quite a bit. So because of a lawsuit and because of the things going on at the National Records Archive, a lot of this, some of your records are at the National Records Archive and some is now at your service.
When you say some, what does that mean? 60-40? Or
I hate to say it's a crapshoot.
Shocking.
Yeah, some of it could be all of it or none of it. So the National Records Archive is supposed to, if they don't have it, they're supposed to contact your service.
Oh, okay.
To get you copies.
Gotcha.
If you live close to a base, it's easier for you to just go into the hospital and try to get a copy if you can. So TRICARE records go back about 30 years. So, but to get back to your other discussion,
sorry.
other one, no, it's fine. The difference between the county VSOs, they're paid by your county or state, same as a veteran VSO. So that service is free, but they're paid.
Right.
So the veteran service officers, we're all free.
You volunteer. Right. That's the thing. You volunteer.
We're all volunteer.
County VSOs are paid by state. It's still free to the service member. That's the whole thing. Veteran service member is still free. Then we get into, go ahead.
So then you get into, there are a lot of extraneous agencies. So legal firms can be accredited. So you can go out to the va.gov and find a list of accredited VSOs. So they can actually do the power of attorney, get your records, and process it. The lawyers can charge you. So it's not like if you get a Medicare disability lawyer where they're capped at $6,000. A lawyer or whoever can get whatever a percentage of your back pay. So it's whatever's negotiated.
Right.
I've seen some people pay as much as $20,000 and only come back at 50%. So, and I work with some of those to get them to 100%. If you don't do it right the first time, it's harder to get it. So as you know, the closer you get to 90 or 100, the smaller the percentage is.
Because it's that crazy math, right?
Yeah, the VA math. So, so you see a lot of that, and people sit at 90 for a long time, and they may have 50, 10%. Well, those 50, 10%ers are barely going to get you to 100%. So you have to look at whether or not your VSO, whoever's doing your paperwork, also lists your residuals or the additional things that count towards that. So let's say you have sleep apnea, but you also have anxiety and depression, so or sinusitis. So if you have all those, then you want to put all those down as a disability, and you have to be able to put the puzzle together. Right. That's what it is.
Well,
it's a medical puzzle. It's
a holistic look, but we're breaking it down into each little, it's like operation, right? Like you got to look at all the different pieces there.
So, the VA got sued, and about 5 months ago, the VA IG went into they looked at 23 of the regional offices and found that a lot of those VSOs that were submitting paperwork were not looking at the complete records. And so they were denying people's claims based upon saying that there's insufficient evidence. So they have to go back and actually look at 500,000 records for people that were denied.
Oh my God. On top of PACT Act, right? So
correct.
You got PACT Act coming in. They get sued. Now they're like, oh man. And I'll add another factor on this. I have somebody I know that works for one of these, I don't know which one, but the subcontracts where they do the medical exams. And I'm not going to name any of them, but they do the medical exams and whatnot. And anybody knows them that's been through it. And she does like their quality check kind of thing. And she looks at the cases to make sure all the information's like ready to go. And told me straight up, she's like, so we work, she goes, they get mad at me all the time because they want us to spend 5 minutes per case. And I was like, spend what? And she goes, and they get commission, like sort of like commission, like how many cases, they get bonuses.
Right.
There you go.
Quota.
Yeah. If they meet the quota, then they get more bonus, right? So it incentivizes them to go fast. And she goes, and you know what that turns into? I'm like, a shit show? She's like, yep. And so they're missing stuff, you know, and they're sending in incomplete stuff or, you know, whatnot, because they're not even given the time. And she's like, they get mad at me all the time because I take longer, but I've been on the other side of it, you know, so I'm not going to compromise, you know. Like, damn,
right.
That was an eye-opener for me.
Well, there's been a couple undercover investigations that have actually been done. NBC published some stuff here about a week ago. Where, you know, they said, yeah, you know, we're in a quota system. So if we find one thing that we can deny it, we just deny the whole claim. So, yeah, because they have the quota system. So I know there's a lot of people that have also had their disabilities and appeal. So in February of 2019, there was a change. So anything that was submitted after February of 2019, that they're going to try to have that done within 5 years. But there are a lot of claims that are still open prior to February of 2019. So there are a lot of different things that go on.
It's so complicated too because it's so massive. And I don't know if a lot of people know this, and this is how I relate the VA, but they're like a franchise. So every hospital is on its own. I mean, there's an overhead, but I mean, so every time you go to a different VA, it's a whole different set of rules, you know, what they're doing. I've seen it. I've dealt with it. When we played in the system and working, I was like, how do they not know this? We don't know anything about. I'm like, isn't that common knowledge? Well, at that VA, it's not, and at some other VA, it is. And I'm like, oh my Lord! And that was an eye opener for me that their continuity is not there because they don't all run together. They don't all communicate. They don't have the same discussions. I guess.
So every VISN is different, and you know what's going on like right now in the San Antonio area. My previous VISN, which actually happened to be in Louisville, Kentucky, was actually 10 years ahead of what's going on here in San Antonio, which is Military City, USA. So, you know, they've only been doing acupuncture and chiropractic here for about 3.5 years. Yeah. Versus I've been doing acupuncture and chiropractor through the VA since 2009.
At which VA were you at before? Yeah. Which VA were you at before that was doing it?
At Louisville.
Oh, wow.
Kentucky. Yeah. So each VISN is different. So now that's part of the whole health. So if you want acupuncture or chiropractic, enroll in the whole health program through your primary care at the VA. And they'll get you in the system. You know, it's a process. It's like still a 3 to 4 month process, but you know,
that's so, you know, for the audience here, I brought you on like PACT Act. We're talking PACT Act, and there is a lot to talk about with PACT Act, but I also like to bring around, like, to have Mike central. One, to get him is rare. So if I can nail him down for an hour, that's like amazing. And to get this knowledge out of him. So I kind of want to tap as much as I can off you. But when you're looking at, when you talk about whole care, right? The whole care that they have now, that is, I'm glad it's coming on board. It has a long ways to go in their capabilities, but it's a start, and you got to start somewhere. So that's a really good thing. But for the audience, I'm going to kind of tie these things all up together a little bit. When you're getting into that system to get care, what is the recommendation if there are waits, right? So what are you doing in the meantime? That's one thing. And how are you maintaining yourself during those waits? Like, what are you seeing people do? It's a little off topic, but like if they're waiting that long, is there other places people can go to get care that you see?
There are. So there are a couple things, So one thing I'll say is you are your own advocate.
Thank you.
And you have to, you're the only person that's going to take care of you.
Right.
Period. So you need to become involved. The other thing to that is you earned it. The VA is pre-funded for disabilities, so you're not taking any money or anything else from another veteran.
Right.
You're actually putting the VA is the largest socialized medicine program in the world, in the history of the world. Mm-hmm. So you need to fight for your own care, and they're supposed to be able to get you a primary care physician within 30 to 45 days. If that's not happening, call your congressman, Chip Roy, Tony Gonzalez, whoever.
Yeah, whoever your state is.
Yeah, wherever your state or your local area is, and say, hey, I can't get in.
So
but,
you answered where I was going. So that's what I wanted without saying it straight out. You answered the question, was that if you're struggling to get those appointments and they're like, oh, it's a 4-month wait, sorry. The answer is like, you need to refer me out. Because that is what they're supposed to be doing, right, under community care. So when you are in the system and you're being told, oh, I'm sorry, it's 2 months, 3 months, whatever, whether it's mental health, whether it's physical health, whatever it is, you're like, okay, well, can I have a referral to community care to get my mental health care or whatnot? The answer should not be no. The answer should be yes.
It's supposed to be 20 days for
mental health.
If you can't get in within 20 days to see a GP, a PCN, then they're supposed to refer you out. It's 30 days for specialty care.
Got you. Okay. So those are good numbers to remember there.
So there are a couple more things. So for survivors, spouses and dependents of veterans who have died of a service-connected disease and had DIC, that's the dependency and indemnity compensation, or survivor's pension or accrued benefits denied. Mm-hmm. All that stuff is now relooked at underneath the PACT Act, and the VA is supposed to be contacting you if you're the dependent, but as we know, that doesn't work that way.
Right.
So it would behoove you, if you know a dependent or a survivor who had somebody that passed away, to actually get them to contact the VA and have them relook at their dependency and indemnity compensation, as well as possible accrued benefits or survivor's pension. Accrued benefits, so if you die, this is one of the things, be sure that you have somebody identified in your will as an executor. Because, example, if you are one of those people that has a claim that's earlier than 2019 and you die, that claim becomes part of your estate. And the executor is obligated to close your estate to file for the accrued benefits. So in some cases, that could be $100,000, $200,000.
Dang.
Again, yeah. So, and there's a couple folks here in this region that have just one individual got 120,000 and one got 275,000 just recently in accrued and DIC compensation.
Is that taxable income? Is that?
No, it's all non-taxable. It's no different than your disability pension.
Right. That's what I was wondering.
The other thing that does is when that goes into play, let's say, so you got out at 12, let's say, and you did not retire. That also allows the disability, the certificate of eligibility for housing, the Chapter 35 for education, all that stuff to cross over to the spouse and the dependents.
Ah.
So there are magic numbers that always go into play, magic percentages, 20, 30%, 70%. One of the things I am seeing, and it's a battle, is we have a lot of older veterans that have dementia, Alzheimer's, and that have never filed. And then their spouse is their caregiver, but you can't get caregiver unless the veteran has a disability. So you have to file for the disability in order for the spouse to get caregiver status. We were talking about assistance. So one of the things I've been doing is actually going out in the communities and trying to get healthcare practitioners to actually, in some cases, take TRICARE or take Medicare or become enrolled in the VA community care program, because a lot of people are tired of driving an hour and a half into the city.
Yes.
And that's kind of working. I'm getting a little bit here, a little bit there. There are some agencies that are grant agencies. So if you're on the example, the west side of San Antonio, up in Dallas, El Paso, throughout the U.S., there's a group called Endeavors, a part of the Stephen A.
That's what I thought you were talking about. Yeah.
So the Stephen A. Cohen Foundation that also does mental health. They have Flagship Health in there. So that's actually a primary care. That's no cost to you, the veteran.
And they do they actually have transport. They do up to so many miles. It's a beautiful facility. Right. I've toured it before.
So the other part of that, there's another one on the east side, or actually downtown San Antonio on Flores Street. Those of us that have been around a little bit probably remember the old American GI Forum magazine that used to have jobs and things in it back in the 90s. Well, they also have a National Veterans Outreach Program.
Oh, neat.
And so they have hotel. They put up homeless. They do a job education. They actually having a job fair November 2nd and 3rd. They're having a stand down, and it's for veterans and civilians on the 2nd and veterans only on the 3rd. They have a mental health as well. They also do telehealth. They actually have their own manufacturing plant, and they employ the veterans. So they work with Flagship Health. So I was actually able to do that tour as well. The other thing is there's Alamo Veterans Network. So the 13 counties that surround Bexar County all put money into ACOG. People have heard ACOG, Alamo Area Council of Governments. And there's a veterans network within that also deals with about 230 nonprofits. And so you can actually call them up, and they have a counselor, an intake specialist that will actually work with you and actually put you off. So I've worked with them on, because I get calls from everywhere. So I kind of help everybody across the U.S. So I've had calls for suicide, spouse suicides, attempted suicides. So when I'm working with a veteran that's married, that's got a Alzheimer's, dementia, or whatever, the spouses have what's called vicarious trauma. It used to be called vicarious PTSD or secondary trauma stress. And that affects them. Your PTSD and actions affect your spouse and your kids. So if I'm able to talk to a spouse and a kid, one of the things I do, again, from the education side of my background, it's also clinical psychology. So I do a little bit of analysis, and I ask the same thing. You know, it would be like, hey, Donna, are you feeling depressed, anxious? You know, I kind of go through the same DSM-5 questions that psychiatrists would use to let me see how you are. And then I try to get you help as well. So not every VSO does that.
I was just going to say, I'm like, we got a VSO plus here. Well, and, you know, not every VSO does that, but really that is, especially in the paid ones, and Mike and I know this, that's what they're supposed to be also helping with, is connecting to resources. That is a big part. So let me ask this question. So a lot of what Mike was talking about was actually local with Texas, like ACOG, and Endeavors is actually in different places, and the Cohen Clinic. We just happen to have the flagship, a big one here in San Antonio. And so we've seen it. It's really nice, great facility. But if they are not here, and they're nationally, where do you recommend, let me tie this back towards like the PACT Act, where do you recommend people start? Like, they're like, holy crap, my kid has ADHD. I sat on a flight line for, 20 years. There could be a relationship here. Like, how do I start with the PACT Act? What's the first step?
So if you're the veteran or the spouse, of a veteran, or you have kids, I would say you can contact the local VA environmental coordinator. Some of them will tell you no. Others will tell you yes. Or you can go online and do a search for VA, or actually go talk to a Medicare disability attorney.
Oh, interesting.
Because some of those actually are accredited.
Mm-hmm. And they can help with, do they know about the PACT Act, or are they?
With the PACT Act.
Oh, interesting. Well. That's I didn't know that. But they can apply online, right? They can do what they call intent to file, right? Intent
to file. And the intent to file actually basically gives you up to 1 year to get the information into the system, and will guarantee you a back pay to the date that you file.
Right. So if you're not even sure, and here's the nice thing, if you're not even sure, like I think I want it, but I'm not really sure, just file it. Yeah. And if it pans out, that you're like, that's not it, I don't have it, or you're not doing it or whatever, it really is no harm, no foul. It'll just sit there. And then I think after a year, they'll just like close it,
Close it, right.
Yeah. So it's no big deal. If you're not sure, do an intent for file, and then, work on it from there, like I am, extremely slowly. But
true.
It's in the back of my head.
One of the things I get is, especially when I talk to people, is, I wasn't, I didn't do that, or, I'll use medical. So a lot of medical people wind up being security forces augmentees, right? So what do they do during exercises, or when shit hits the fan or something? They become security forces guarding the planes on the flight line.
Right.
So you are exposed to that.
Right.
People in the hospital that work in the OR, NICU, ICU, anesthesia, oxygen, nitrogen, all those stuff are in mass quantities are considered toxic exposures.
Yeah, and we're around it all day. I mean, that's what we're doing all day. And a lot of people, like you say, that's a very common thing. Like, oh, I'm not really that broke. Oh, I don't want to take from someone else. I'm glad you said that. Like, hey, you're not taking from other people. That is congressionally funded for every person. And Congress said, hey, we're going to open this up now. And VA, you got to handle this, because, there's a lot of, we're realizing that we stick people on bases that after everything you just said, they're very toxic. Like,
right. And the other thing is, according to the August 2nd of 2020 change to the Manual 21-1, which is the VA Adjudicators Manual, COVID and the COVID vaccine are viable disabilities.
Okay.
And it's supposed to expire January 5th of 2024. So how do they already have an expiration date on it? Right.
Yeah, I don't know. But if that's another thing. Like people ask me all the time, like, oh, should I get it? Should I not? I'm like, you got to weigh a lot of stuff, right? So if you were somebody that did receive it and you notice afterwards that there's some effects, then apply. Apply. Just put it on
Correct.
there. It's not a problem. You are not taking from anyone else. And so when the PACT Act came down, it just finally acknowledged all this stuff. Like, how long did it take for just burn pits to get acknowledged? Yeah. I had service members that are like, I just got diagnosed with asthma at 35 years old. I've never, ever had a problem. And now I can't shake the cold. I get pneumonia real easy. I wheezy at certain times. There's just a matter of time that the evidence becomes overwhelming that we had to start acknowledging. And fortunately, it was a tiny bit faster than Agent Orange. But I am telling you, my father-in-law passed away, and we are pretty confident that it probably stemmed back to his Vietnam days, And
so one of the questions I always ask is, did you have a vaccine reaction?
Yeah.
And when people give me a lot of symptoms, especially a lot of these younger people that are in the process of getting out of the service now, I will ask them, did this happen before or after you were vaccinated? So, and the records, when I review the records will actually tell me. So by virtue of the dates, and I actually see a lot of that, that a lot of them have vaccine reactions. They all have, a lot of them have cardiac issues. A lot of them have fertility issues. And these people are in their 20s, 30s. They have joint issues, body aches.
What's the one?
Sinus.
Is it conversion? God, I'm going to get the name wrong. But essentially, you will have symptoms for a certain amount of time. I actually had a student in college, not a veteran. It was interesting. She had this where one day she could walk and one day she couldn't. So some days she'd come to school in a wheelchair. She's like, oh, it's one of those days. And then other days she'd walk in the door. It's conversion or I cannot remember the term. But there's an actual term with that. And there was a high association with the trauma and burn pits and all that other stuff going on with veterans, that they were having all these symptoms, like they'd have the symptom, then it'd be gone, then they'd have this, and it'd be gone. So I've seen so many veterans that would have, a compilation of these symptoms of different things, and they can't get any traction. So I'm really thankful that the PACT Act came in, when it did, and that these people now are getting recognized. Because, here's the other half of it, is there's one thing for the VA say, hey, this is the VASRD, that's their rating system. This is the criteria you meet or do not meet, right? Black and white, like you meet it or you don't. But it is another thing when you know that you are not who you are having these symptoms, you are having these issues. And then there's this psychological component when somebody says, sorry, we don't believe you, quote unquote, or you don't meet criteria. Maybe it's that you don't meet criteria. Like, and so there's that mental component that just weighs on it. So when you're increasing stress levels, you're not getting better, right? You're getting worse, right? So it's not behooving the VA or Congress or anybody to deny all this stuff, because essentially the people are just going to decompensate more mentally, physically, and now you're still going to pay for it. So why don't we just get on the ball, which hopefully the PACT Act is doing, and start compensating these people and taking care of them like they should have been taken care of a long time ago.
Well, and veterans will couple things veterans need to look at. So basically the disability is 38 CFR,
right.
Part 4, the Code of Federal Regulations, 50 and 54 CFR, and DSM-5, which are the three things that deal with mental health.
Mm-hmm.
So if you were actually to look at those and kind of, I know it's kind of technical for a lot of folks, but just look at it and that'll say, okay, well, these are the disabilities that the VA looks at. Now, if you're 100%, right, I get this question a lot, should I apply for the PACT Act? The answer to that is yes, because you're not just helping yourself, you're helping a fellow veteran.
So why, it's funny, this comes up a lot, right? When somebody's 100%, mm-hmm. permanent and total too, right? If they're, whether 100% or 100% permanent total, there is a nervousness about reapplying for anything because there's a fear that they could take it away.
So I've had that conversation with a lot of people too. So the way that the system is set up is they don't want you to do a lot of claims within a 5-year period. So that's why it's important that you do all your claims, the majority of your claim the first time. So because by the time you get to your third claim, you have to tie everything back into the first claim, if that makes sense.
So it almost like red flags you, when,
yeah.
Okay.
So, you don't want to file 3 things and then file 3 things and then file 3 things. File 9 things, right? Because what they'll do is they'll award it, and then if you do 2 years later and you do another one, then you look at it and you're saying, oh, wow, well, I was 70, now they dropped me to 50. The VA is all about money.
Right.
So they'll drop it down and adjust it and still keep you at the same percentage you were before on average, versus if you do it right the first time. So on average, I get about, when I screen somebody's records and talk to them, I'll come up with about 60 disabilities on average per person.
Jeez,
and that's
Louise.
After they've seen somebody that's, and that person could already be at 50, 60, 70%. So the other thing is as soon as within 1 year of when you get out, be sure that you go to the doctor and get stuff documented. Because
that's critical. Yes, that's critical when you're in also, because we're all guilty. Right. We are all guilty of this. But, we're like, I'm fine. Oh, I'm not going to worry about it. Oh, whatever. And blow it off. And I get it. I did it myself. But as we're maturing and we're getting on in our years, and then things, that little niggly knee that was really no big deal, you could slap a brace on and just go to town and do your squats and everything. Well, now you've got more overuse injury and it's really hurting now, and you have no proof that started 5 years before. And correct. People always have the like, oh, we're just being whiny. Like, it's really not. If you can reframe it, and I say this as a standing hypocrite on this because I was just as guilty, but if you can reframe your mind that you're just getting this documented, and don't worry, they're all just going to give you Motrin. I mean, if your leg's hanging off or it's just a twinge, it's all the same treatment. It's Motrin, right? Yep. And so, but at least it's documented. And then when that knee hopefully doesn't, but if it worsens, then they can follow the trail. But if all of a sudden the first documentation is you need a knee replacement and there was no acute injury, like, where do they go from there?
So I tell people, you have to get out of, I tell them you have to get out of the good soldier attitude. Yeah. You also have to get out of the suck it up buttercup, while you're on active duty.
That's how we're trained. Yeah. But we're not trained. We're not trained as an individual. We're not trained as this person. You're trained to be part of a team. And if you're failing, quote unquote, your team in any level, then it wreaks more havoc, right? And so we all just like, I'm fine. Everybody's fine until we're at like 17, 18, 19 years and we're like, ow, why am I so broken? Why can't I sneeze and something's pulled, and now we have to look back and go, oh, we're all guilty. So we're trying to tell the young ones, wake the hell up. Don't be stupid like us.
Right. And so, people look at me and they're like, well, nothing's wrong with you.
You look intact.
I look good. So, but, on the inside, I'm jacked up.
Broke.
Just,
broke as a joke.
I'm broke. Yeah. And so, and you look at a lot of veterans and you'll see that. But, the older we get, the less mobile, so, I always have to carry a cane in the car because I never know if the back or the hips are going to go out or whatever.
Oh, I thought that was just your singing telegram routine that you were doing. Oh, sorry.
Yeah. I'm kind of working on that. There've just been a lot of changes that have been happening here lately, and it's not just the PACT Act. There was another lawsuit, and I was going to put this out anyhow, but it came about because the veterans that were kicked out for PTSD, anxiety, TBI-related issues, and they got a other than honorable.
Yes.
In that, right? So, which made them ineligible for benefits and things like that. Well,
correct.
Supposedly, the VA is supposed to be looking at the 250,000. DOD is supposed to be re-looking at 250,000 of those to correct those as far as upgrading to at least a general discharge, which makes you eligible for benefits. So if you're a veteran and you're listening to this, or a veteran that got out because of PTSD, anxiety, depression, or a TBI-related issue, then they need to contact and actually appeal their discharge character to the Board of Correction for Military Records.
If they were less than honorable, right?
If they were less than general, other than honorable.
Other than honorable, right?
Yeah. The BCDs are pretty much going to stay as a BCD.
What's a BCD?
Bad conduct.
Oh, well, yeah. I mean, that is a big deal. We did a whole series on veteran treatment court, and that's a phenomenal program. And if you guys don't know what I'm talking about, go back. We have like a series of 4 or 5. It was just an amazing learning experience. And to one of the things I asked the court coordinator, Laura, I said, she goes, she's actually still in the Navy Reserve. And I said, how many of these people do you see that are getting out? She's a paralegal, that were getting out that had PTSD and were being separated for like conduct issues or they were leaving on their own accord, whichever. And she's like, almost all of them. She's like, in the treatment court, all of them have PTSD. And it infuriates me because they weren't properly diagnosed. They weren't caught, so to speak. They weren't given the tough love to get this treatment. Or, God, hopefully, because I've seen this too, they're just like, I'm fine, don't worry about me. And then it led on to bad choices. And here they are out with no benefit. And in some cases, bad conduct and less than honorable. And now they cannot get benefits. And where does that leave them? Well, I mean, that's horrible.
And the other thing I'll tell you with these folks is when you get out, there's what they call a RE code. That's your reenlistment eligibility code. So if you tell somebody that you're in the service and you could have got out with a general discharge but had a RE code of 4, an employer can turn you down because they'll look at that DD 214 and say, you're a RE code of 4.
Which is what, less than honorable or? Less than?
No, it just means that the service really won't take you back in.
Oh, yeah, right. I know.
Right. So re-enlistment eligibility codes play a major factor on your DD 214. So be sure if you're getting out that you understand everything that's on your DD 214.
Yeah.
Especially the re-enlistment, the RE code.
I hope mine's like a 2 or whatever the worst one is that they'll never take me back. That's the one I want.
4. So the other thing, too, that I want to just touch on real quick is I have a lot of folks that are, they ask me about medical discharge versus MEB versus retirement versus just getting out. Mm-hmm. So if you're given a medical discharge and a 30% disability and a severance pay, then that severance pay has to be paid back to the VA in order for you to get care from the VA. Lovely. So, and that's a separate disability. If somebody says that we'll give you a choice, a medical discharge or an MEB, medical evaluation board, take the medical evaluation board.
What's the difference when you said that between medical discharge, just for the audience to understand the difference between medical discharge and an MEB? I mean, there's a difference. So
right. So you have an informal medical evaluation board. Then you have a PEB, a physical evaluation board, and then you have the formal medical evaluation.
That's all in the medical evaluation board, right? That's the formality that says we're going to pay for whatever it is when you get out. But a medical discharge, what's the difference?
So the difference is with the medical discharge, in some cases, you're not necessarily eligible for certain benefits when you get out.
Right.
So, and then, so I give you $30,000 and you're actually going to get $21,000. So people think that's a big deal. Right.
Well, let me add, there's one more level to it. And the only reason I'm jumping in is because I know this was my job for way too many years, but when you're less than 30%, it's severance, right? They do not do the medical retirement. That is that. So if you're less than 30%, you are not getting a monthly check. You're not getting any of that. They're going to say, here's that severance. But there's also being separated for medical. You get nothing.
Nothing. That's correct.
And what the military is saying is, hey, you're like broke enough that we can't retain you. But none of those are service connect. They're not like nothing to do with us. You see this in the Guard and Reserve side. This is where
Correct.
You see it. You don't see it in active duty. But these people can get sent out the door because they have conditions that do not meet retention standards. But the military is saying they are not military connected. We didn't cause that, which that's a whole other story. But anyway,
Correct.
They say, okay, you're not worldwide, you're not retention eligible. Have a good day. And then they send you out the door with zero. No severance,
Right.
no nothing.
And that's where, so the DOD directive and each service directive actually mandate that the respective services follow the same disability guidelines as what's in the VASRID, the 38 CFR.
The VASRID, right?
So, but they don't always, you as a service member, they're supposed to provide you legal counsel when they're talking to you about medical discharge.
So
versus an informal.
Right. So there's some DOD guidance on that. Now, it could have changed since I got out, but here's the rule is supposed to be now. I said, please go validate all your information because it changes all the time. But my last understanding is, and this is what we used to advise them, when they were going through an MEB, I think it's by DOD or even NDAA, I'm not sure which level, they are supposed to be provided a lawyer at the time that they are told they're having an MEB. Now,
DOD.
Yeah, okay, So DOD. Navy does it, Army does it, Air Force.
You get it when you get to the formal.
And Air Force is like, oh, we don't have enough staff. And I know, I literally worked with these guys. We don't have enough staff. So get some, because if the Army and the Navy can do this, can do it. So what they do is say, oh, we don't have enough staff. So we do it at the formal level. We do it when it's a formal board, which is the step after the informal. So when you go through an MEB, you go through the informal, and that's the first rating. And then you say, oh, I like it, or no, I don't. And if you don't, you get to appeal to the formal board. And at that point, when you say I'm appealing, then they give you the disability lawyer, right, the attorney.
That's correct.
So which I think is crap, because they should be advising you before that. Now, I will say, for all my little Air Force buddies, you can call the area, I think they're called ADC now, Area Disability Council. You can call them and talk to a paralegal, and you can ask questions. Even though they're not taking you on officially, they will answer your questions. They're good people. So, but there is that process that they are limited on for the Air Force. So, yes.
Right. So part of that process, and I'll tell you, because I was medically boarded 60 days short of 20. They offered me 30%. I turned them down. When I met the board here in San Antonio, I came in with, again, you have to understand the rules. Mm-hmm. So I understood the rules. You need to understand what the requirements of your job are. So that's your pulleys, if you remember your profile, PULHES. Mm-hmm. So every job and every service has a minimum standard. Mm-hmm. So by the time I got boarded, I was over 20, and I'd already tried to retire, and they wouldn't allow me to retire, which was kind of funny. So I met the board, and I met my pulleys requirement by the regulations, but my injuries qualified me for 100% medical retirement.
How does that work?
The board's decision was to return me to duty because it would save them about 40% in retirement benefits.
So that is a tactic. I will tell you that I personally fought that fight when I was in. It was one of the last meetings I had with, I think Afric. And I was shocked because, and for the community, this might get a little technical, but there is certain codes that return you back to duty. So you can get fully returned, go get them, Tiger, you're great. You can get an ALC 1, 2, or 3, and yep. Each of those will limit you a little bit more, 3 being the most limited, which pretty much says you can show up at work and that's about it. You can't deploy, you can't do anything else, but you can come to work. And what I found shocking was that I found stats that showed that the reserves, who was the smallest of the 3 groups, reserve, guard, and active duty, had somewhere close to 10 times more, probably about 8 times more, ALC 3s than the active duty. Active duty at the time had 44 active duty. Mm-hmm. I knew the person that was running. She was a friend of mine. I go, why do you have such a low number? She goes, well, it's more for cancer patients, like to get them back. I said, oh, that makes sense. And give them that chance to recover and recuperate and everything. The reserve had 347 or something like that. And I asked them, I said, why do you have 7, 8 times more ALC 3 returns than the active duty, who's 2-3 times bigger than you? And they try to come back and say, oh, well, we don't know what denominator you're working with. I'm like, yeah, you do. You're looking at the total number of active duty and the total number of reserves. So they didn't have an answer for me. They didn't have an answer at all. So I was like, okay, well, I don't think it ever got resolved, but it is a tactic. And I've seen it when they're close to retirement eligible, they do a return to duty with an ALC 3 or something like that.
Yeah, usually it's an ALC 1, and then
ours are 3s all the time. That's what blows my mind.
Yeah. And then you have to actually file with the BCMR.
Yeah, which is Years.
a long time.
Yes,
Yeah.
and just for you guys who don't understand that, BCMR's Board of Correction of Military Records, it is the only entity that can actually change your military record. And it's a real quote-unquote nicety, right? It looks nice. It looks like a very non-threatening form, pretty easy to fill out. But it actually is a long, drawn-out process. And I will tell you my personal spin on it for whatever it's worth. It is there on the front side to correct military records for an injustice or for any mess up in your records. What it really does is save the military from getting lawsuits. It saves them from not having to deal with one litigation after another. And so that's the other half of it. I'm not saying that there's not some level of goodness in it, because I have seen people get their records corrected, get compensated, and good things happen. But I am telling you that is not the primary reason that exists. The primary reason it exists is so they can avoid having to deal with all these lawsuits and fix any, corrections. It does not fix processes, just so people understand that. If the process was messed up, they are not going to go back and slap hands. They're just going to correct and they're going to move on. Hence, again, why it is there for them to get out of more lawsuits. Because if it was really altruistic, they'd go back and fix processes, which doesn't happen.
Right.
So, yeah, unfortunately, I'm a little too familiar with that stuff. All right, here, Mike, we're winding down here. We're pushing that hour, so and we could
it's
talk.
A lot of stuff.
It is a ton of stuff, and we can talk for hours. And every time you and I get within proximity of each other, we both are like, oh, we know it's going to be a while. Like we either have to have time or we have to just scoot because we'll talk forever. So I appreciate you coming. This is awesome. Is there any final thoughts that you want to give to people in regarding to the PACT Act or disabilities or applying or anything like that?
Well, first of all, thanks for having me, Donna. I think that veterans as a whole, when we get out, we kind of lose focus and we lose sense of purpose because we've lost that family. Because we have our home family and we have our service family, and veterans are the largest family in the world. So any country you go to as a veteran, say, oh yeah, I served in the military in the U.S. Oh, welcome. So I would say if you know a veteran, talk to them about filing for their disabilities. We all have them. We may look good on the outside, but we're all broke on the inside. Really good maskers, aren't we? Yeah. Mm-hmm. Yeah. So, we do need to get out of the suck it up buttercup and be more proactive in our own health care. Get your records, get your C-file, file. Don't be afraid. Even if you're 100%, file. Because you're not just helping yourself, you're helping a fellow veteran. I will also tell you in the States that you're tax exempt, i.e. if you're 100%, Texas, Florida, Tennessee, Virginia. So there's about 17 states. If you're 100%, still contest your property tax every year. It helps your neighbors. It helps your neighbors. You don't want to gentrify your neighborhood and wind up with a whole lot of apartments. Yeah. So, you can be in your own little castle, a veteran, and then wind up with 1,000 apartments right around you. Right around the corner, yeah. Yeah. So, and then if you're the spouse or dependent, well, first of all, you as a veteran owe it to your spouse to file for disability. Because I also have a lot of veterans that are older that their spouse never worked. They gave up. If they never filed, when that person dies, all they're going to get is the disability benefits and no DIC or anything else for... let me bring this up real fast before we wind it down, is that because you and I ended up helping a lady that her husband passed away 10 years ago. And I was just having a random conversation, and I find out that the only benefit she had was TRICARE. That was it.
And I was like, wait a minute, you're not getting, and the long and short of it was she tried to file for him after he had had a stroke. And the doctor so kindly said, oh, well, since he's not verbal, then you can't file for anything, which was completely wrong.
That's correct.
And so now we're in the midst of trying to help her get compensation. So the only thing I say, because we could talk about that, the only thing I say to that is that if you are a spouse that has lost your partner and you do not have any benefits and they were in the military, you need to go talk to a VSO, a CVSO. You need to go talk to somebody and see if there wasn't a period where they should have been covered, you should be covered. You just need to check it out.
And you can request your spouse's medical records.
Right.
So if you were married to the individual, the other thing is when they die, you are eligible for CHAMP VA if you don't have insurance, and that in turn will assist you. So it's kind of a little bit like Medicare in some instances, and you could remarry, in which case it goes away. But then if you get divorced or that spouse dies, then you can apply for CHAMP VA again.
Oh, see, good to know.
Yeah. So, and then the certificate of eligibility for the home. Some states will transfer all disability benefits over to the spouse.
Texas will do that.
Correct. And some won't, but the VA will transfer the certificate of eligibility and your Chapter 35 benefits. So if you're a spouse and you want to go back to school because your spouse died, then you can file with the VA and go to school.
Great.
And
okay.
So it's a lot of stuff. The VA programs are really vast. And unfortunately I had to work with a lot of them while I was on active duty. So I worked with a lot of them for 13 years on active duty. So I'm familiar with a lot of them, which made it a little bit easier to do this.
All right. Well, Mike, I said you are a wealth. You could do a whole college course on how to navigate the VA. And I mean, it's intense and it's a lot. But for the audience, just to break it down and not to be so overwhelming, just start at the beginning. And if you're really not sure or it just feels overwhelming, contact your local VSO. You can go to the DAV, you can go to the PAV, you can go to VFWs.
American Legion,
American Legion, and it does not cost you a thing, and that is where you should start. And that's really step one, to look at everything. Yes, if you're 100%, I know it seems scary, but really evaluate everything. Look at the PACT Act. It really did open up. If you have children that have learning disabilities, things like my child with ADHD, then you really need to look at that, because that actually could benefit them in the future. So, we're not just doing it for us, we're doing it for our family. And so I hope this provided just a little bit of overview. We did talk about a lot of different things, and we did hopefully not rabbit hole too much, but I really wanted to highlight all those different areas that you need to take into consideration. And so, Mike, I greatly appreciate you coming out and taking time. And the fact that I got you for an hour and some change is a miracle, because I won't see him again for 3 months. Don't worry.
Yeah, I've got I was actually working on a bunch of disabilities so I took a break. It's a good break.
That's right. It's good. So, all right, everybody. It's Beyond the Front Line, and it's Donna here. And we just give a big shout out to Jay. Make sure everything's going well for him. I hope you guys like, share, comment, engage. We really want to hear from you guys what you want to hear about, because this is all for you, our veterans and their families. So from all of us here, from Coming Home Well and Beyond the Front Line, to all of you, we hope you have a great week.
Thanks for listening to Beyond the Front Line, a podcast of Coming Home Well. Join us every other Wednesday. And if you enjoyed this episode, please share it with others, post about it on social media, or leave a rating and review. Thanks again. And until all are home and all are well.